You're watching Sarcoma TV. Knowledge is power.
Personalized research really does get into great detail. This is the basis of precision oncology. First off, we would look at your medical history. Then we would look at your tumor and you would see if there's specific mutations driving your cancer that can be targeted. Then we would want to look at how those mutations interact with each other. So in other words, does a mutation in one gene prevent the use of a drug that targets a mutation in another gene? These can be called inactivating mutations or desensitizing mutations. And then coming up with a combination of drugs that are targeted together that will target all of the different molecular pathways that are causing your cancer. And then finding out which combinations of these treatments are going to work best in your subtype. That often requires some clinical trial research that's often available. And then obviously an important point is dosing. You know, how much of this combination do you need? There's a perfect example of that is recent data shows that in both colorectal cancers and pancreatic cancers, a modified version of the chemotherapy protocol, which is a multi-drug combination called FOLFIRI or FOLFOXIRI, that involves multiple drugs. Sometimes you don't need to have the full dose, and that a modified version is often just as effective, but produces a lot less side effects and allows the patients to stay on the drugs longer. So looking at dosing is really important. You want to see if the reduced dosage of the particular chemotherapy drugs you're on or whatever drugs you're on, is it as effective as the standard dose? An important thing is using a drug that's FDA approved. We would never typically want to use a drug that's not FDA approved unless it's in the context of a clinical trial, but there are so many FDA approved drugs out there. It's not hard to find one for everyone's cancer. And then also using clinical trials. Clinical trials are a great way of getting drugs for free, expensive drugs for free.
Thank you for watching Sarcoma TV. Subscribe below and stay informed.